Thanks for joining me today. My name is Melissa Fernald, and I specialize in mental health and addictions. I have been in the field for 28 years, and I interview experts who can provide people with hands on techniques and cutting edge approaches to work through issues related to emotional well being, such as mental health diagnoses, such as depression, anxiety, ADHD, addiction issues, alcohol dependence, opioid dependence. And today we will be discussing functional psychiatry. And I'm going to let our expert tell you more about that today. So let me introduce to you Peggy Ouellette. Peggy is a family psychiatric nurse practitioner who takes a unique, holistic root cause approach to family psychiatry. With more than 25 years of experience in the field, she founded Functional Psychiatry to be able to partner with parents to teach simple and sustainable lifestyle and natural approaches, your health and moods. She helps you to the root cause of your health and moods so you can uplevel and optimize the health of your entire family. Hi, Peggy. Thanks for joining us today.
Hi, Melissa.
Hi. Could we start by telling us a little bit about what your background is in and what brought you to starting the company Functional Psychiatry? It's a concept that I hadn't heard of before um, your company started. So we would love to hear more about that.
Sure, thank you. So it's functional family psychiatry. And I had been working in my own practice for many, many years, working with kids and families. And I've had a lifelong passion for working with kids. And so as a mom and a grandmother and a mental health provider for over 25 years, I totally get it. I now understand that our kids can be what I call a check engine light for the whole family. So, I've experienced addiction and strained relationships in my own family.
Mhm.
And so, what I know is when our kids are struggling, it's a reflection of what's going on with us as parents and in the whole family. So what I do now is I strive to teach parents how to connect and heal those relationships with their children before it's too late. And so I really like to focus on prevention.
Okay. So now, how do you move from how does that involve, psychiatry? Because prior to this, what I understand from reading your bio is that you had a practice where you provided med management services to families and their children. Is that correct?
Yes.
So how did we get to this shift to
What I recognized is that families needed more. So just simply prescribing a medication wasn't cutting it. So I want to kind of talk a little bit about sort of what functional medicine is
Yes.
and what, traditional psychiatry tends to be more of a traditional medical model. And what I felt like was families needed more. Families were asking for more. And so I continued to learn more and go deeper diving into this functional medicine world because what I learned is that what was going on with kids in their medical symptoms in adults. Have always treated adults too, even though my love and specialty is with kids, but what was going on in their bodies was happening in their brain. And so it wasn't necessarily a medical issue, or they were saying, I'm going to see my doctor for headaches. But they were like, and I would ask them about their medical stuff, and I was doing workups and labs and all kinds of things. And there was some confusion about that. And so what I understand now is inflammation in the body means inflammation in the brain. And the psychiatric symptoms are not going to improve without improving what else is going on in the body. So I really needed to create a multi-pronged approach. It's some functional medicine providers you go to, and they'll do all kinds of these expensive labs and do all kinds of things. And, they're going to send you home with all kinds of supplements, hundreds and hundreds of dollars of supplements. And then your medical providers will understand that you have certain symptoms, and they'll send you home with, prescriptions and medication to address whatever is going on.
Okay.
And so, but what people need is more of a lifestyle approach, and to teach them how to make things work so that they're not just dependent on a medication. So we're helping to really treat what caused the symptoms to begin with.
So what I'm hearing you say is that, and I see this in the therapy practice, when I've done therapy with children, or even, adults for that matter, that things are always separated. Oh, I go to my medical doctor for the headaches, or I'm having trouble sleeping, so I go to my doctor. But they don't bring it up to us, to therapists, when it's actually tied into a
Right.
mental health diagnosis that I can actually help with cognitive behavioral treatment approaches and techniques. So it seems similar to what we experience in the field. Would that be
Yes,
accurate?
definitely.
Yep. So tell me, so is what you're doing then is running medical tests with people and then just giving them supplements?
No,
Okay.
no.
Okay. Okay.
It's a great question.
Yes.
Yes.
Mhm.
So don't get me wrong, there are supplements, and I would love to make sure we include that in this interview today. Some basic supplements that people can take to help really prevent and address a lot of their moods and physical things, but it's not just supplements. Other than the basic supplements that I do recommend for pretty much for all of us. Um,
Can I interrupt you for a second?
sure.
For the audience, when I hear the word supplements, I'm thinking vitamins, I'm thinking, St. John's wort and these kind of things that I can go into the grocery store and just buy. Is that what supplements are? Vitamins?
Right, typically vitamins. Supplements, another way of thinking about supplements is the body, the body is designed to heal itself. And we need all kinds of vitamins and minerals and amino acids to allow the body to function and work like a machine.
Okay.
And
Makes sense.
so when we have to supplement, it's because we're not getting everything we need from our diet, from the sun, from, from the earth, because from our foods. So our foods are a primary source of most of our vitamins. So when we have to supplement, it's because we're depleted. And a lot of medications that people are taking now, including psychiatric meds, they actually deplete our vitamins, and they interfere with the absorption of vitamins.
That's very
So
interesting.
we have to supplement, and that's where the
Mhm.
word supplement comes into play.
Okay.
It's a great question.
So you and I spoke before we started, so I
Mhm.
have a little bit of background around food as well. Do
Mhm.
you find that when you first start to see somebody, that when you're assessing their medical needs, you're running the test, you're looking at, what's going on in the body? I would love for us to talk a little bit more about like what specifically are you looking at and how that ties in with the psychiatric issues. But first, I just want to step back and is that an initial thing? And then once they get up, can you change your diet so that you don't have to take so many supplements? Is that an option to treat?
It's a great question. Maybe.
Yeah, okay.
With it, even so,
Maybe.
here's what I tell people. I say, because I've been doing this for so long, and I'm like, I understand, nutritionally, blah, 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 but even if I were eating the colors of the rainbow on every single plate of food that I ate, and I ate the highest quality, organic, blah, 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 I would still need to supplement, because it's really nearly impossible. I'll give an example. Magnesium is one that we used to get in a lot of our food because it would come from the soil. but because of over farming and overusing and stuff, our soil is depleted in magnesium. And I'm going to say, and the number might not be exactly right, but like 95% of people are magnesium deficient. And magnesium is a crucial vitamin mineral that is required for so many mechanisms of action in the body. So the long answer is probably not. I probably would still need to supplement, but you'll feel so much better, and everything will work better when you start to change how you're eating.
Thank you for that.
Yes.
I want to piggyback on what you're saying, because you see this on Facebook, Instagram. I see it in my office all the time when, you're talking about like, oh, well, your body is deficient in this. Or, you're not eating enough vegetables, and, you're allergic to this. And a common response is, why are we all of a sudden deficient in magnesium? Why have we've never had these issues before? Why now are all these allergies coming about? Could you speak to that?
Oh, thank you. Yes, I would love to.
Thanks.
Part of the reason is because why is everyone really in a way sicker? Is kind of what, in my opinion, that's what I hear.
Well, some people don't believe that they are sicker.
True. Yes. But why is it all of a sudden?
Yes.
Part of the reason is because unfortunately, and I'm rolling my eyes a little bit, what the US has a terrible reputation for is things that we're putting on our shelves is not actually food. So what
do you mean by that? It's not
so
food.
food is
Providing
something,
food.
right? So we think it's food, but it's actually all kinds of junk in there that's actually causing us to not absorb the nutrients when we do eat food. So what I call food and what many people call food is meat, vegetables, fruit, things that are whole, that are grown in the the gatherers and the hunters, what they did. That was sort of the origin. So those folks didn't necessarily have nutritional deficiencies. And I don't know about that, but really
Right.
like, because they were able to get what they needed, even with the seasonal eating and all of that, like they were able to nourish their bodies in the way that they needed. So when we are eating junk, we call it the standard American diet, or SAD, which is generally considered just junk. So we
What's
either have
junk? What do you mean?
junk is considered,
I know what junk food is.
right?
Cheetos,
Yes.
Pepsi.
Yes. Oreos.
Yeah, I love
things.
Oreos.
Yes. Right. And so those things are not considered food. So we have food and then we have not food.
Okay. So food and not food.
Yeah.
So food is healthier for our body. And
yes.
okay. So let's go back to the psychiatry piece, if you
Sure.
don't mind. So let's say you have a client who has depression. Okay. And I see that in my office, and, they'll come in and they'll be like, they're not sleeping well. Their appetite has shifted. Sometimes when people have depression, they don't have an appetite, but other times, to manage those depressive symptoms, they're overeating. And when they're overeating, they are eating whatever they can get their hands on, which technically probably is the junk that you're talking about, is my guess, right?
Yeah.
So they come in and, I've gone to my doctor. They gave me the trazodone to help me sleep at night. And I'm still waking up and feeling anxious and no motivation. So, but they don't want to take medications. And a lot of us therapists, we're trained to like assess that depression, treat it in the office. But if they have clinical depression that's gone on for, 6 or more months and they've had it for years, my first response has always been, you need to reach out to your doctor, which I prefer a psychiatrist, because I find that PCPs don't have that same knowledge to give them medications and have them follow up in a way that is effective.
Right,
But the more and more of my clients are coming in and they're saying, like, I don't want to put any of that medication in my body, right?
right.
But at the same time, if I happen to ask what you're eating, which hasn't been typically a question I've asked, which we're going to talk more about, until recently I've been asking that question, they're eating junk,
Mhm.
which is probably not helping a lot. So can you speak to, like, what could somebody do, or what could I say to give them to help them manage some of those depressive symptoms without getting psychotropic medications?
Great, great question. So there are a lot of places to start. And top of the list, you could, as a therapist, you could encourage them to ask their doctor to check their vitamin D levels and their vitamin B12 levels.
Okay, so for the audience, so your vitamin D levels. Explain what if so vitamin D is in our body, right?
Right. And we produce it when we are exposed to the sun. However, even people in sunny California who are, exposed to the sun way more than we are on the East Coast. So, back in my earlier days of training, we were told, if you live on the East Coast and you live in certain areas of the world, you're going to be lower in vitamin D. But now we know it's everywhere. And so, and there are lots of reasons for it. But low vitamin D is highly associated with seasonal affective disorder. And although lots of people I see this, they're still not they're not still seasonally affected, even though they're supplementing with D. And so sometimes there are other nutrients that are involved that are affecting that. So
Could I
sure,
interject?
sure.
So I hear what you're saying, but it kind of from a therapist perspective, um, I look at that and say, you can't rule out the therapy piece because yes, you can give the vitamin D levels are up, they're feeling better.
Mhm.
Okay. So, but in therapy, that's we kind of step in, and that's important to the treatment of a mental illness.
100%.
So, how do you know, like, okay, do you just do what the other doctors do and just keep pumping supplements while really they need to process their depression? And that sometimes what I've found in seasonal depression, aside from the vitamin D, there's trauma. There's trauma that is
Mm,
triggering a physical response.
yes.
And at some point we'll do an interview with an expert on PTSD and how that can play out. But wintertime, we've got Thanksgiving, we've got Christmas, we've got New Year's.
Yeah.
Those who are suffering with addiction and who have trouble
Loss.
that time
Mhm.
of year, so those are components. So how do you work with your clients to join in to treat both rather than
That's a
keep
beautiful
supplements?
question. Because I've spoken to and done my own interviews of experts that deal with, chronic autoimmune diseases and really complex presentations, and had their clients show recovery, and yet give them 6 months or a year later, they return with symptoms returning because they never did the therapy piece. They never did the trauma work. And so those things all go hand in hand. And those are the kinds of things I absolutely work on with my clients, is making sure that they're doing their trauma work, that they're having, and there's several different modalities that I recommend specifically, but having a relationship with their therapist and in making referrals to therapy is absolutely a piece of this.
Fantastic.
Yes,
Great
yes,
answer. Thanks for that.
yes.
Let's get back to what you were talking about what could my client who has suffering with depression.
Great.
So vitamin D. So he or she can get vitamin D supplements. So I go in to the grocery store or to Walmart, right? And there are so many vitamins. And
Yes.
so I had a client the other day, we were discussing this, and I was recommending some vitamins to help him through coming off alcohol. And vitamin D was one that I gave. And but then we started talking about, like, he went into the store and he's like, well, I couldn't figure out which vitamin D you wanted me to do. Vitamin D, vitamin D3. And could you just clarify that for people so that I want my viewers to be able to walk away from this and say, you know what? I'm gonna go and I'm gonna go get vitamin D because guess what? You don't need to get tested to know that you need more vitamin D. It's the winter time, there's sun, and most of the population is deficient in vitamin
Correct.
D.
Right.
So what could with the viewers?
That's a great question. So I'm gonna caveat this by saying, whatever we're talking about in this video, you should always run it by your primary care provider and let them know, because there are some conditions and some medications that can interfere, clotting factors, and like there's some things that
With vitamins?
with
Oh,
vitamins, correct. So
okay.
for example, vitamin D, we typically recommend vitamin D3.
Mhm.
You can do D2, but it takes longer to convert it in your body. And so I typically recommend D3 plus K2 because of the absorption and how it works in your body. They seem to really work synergistically.
What's
So
K2?
K2 has to do with how it's fat soluble and how it's absorbed
It's
and
another
how
vitamin,
it's another
K2.
vitamin,
Okay.
correct.
So
Yes.
we're talking about
Yes,
okay.
and it tends to, like I said, people with clotting factor medications can be problematic for them. So
Mhm.
that's my thing, is you always have your pharmacist as a resource. So if you are at your grocery store or wherever or your pharmacy, wherever you typically go for your medications, run it by your pharmacist and say, is this going to interfere with any of my meds? Do you think this is safe? And they may defer you to your doctor. But I just want to say that as a safety measure. So I'm not out here just left and right, willy-nilly, take this and take that. And it could, there are problems with certain things. So
Okay.
as a caveat, it's kind of important.
Well, I mean, it makes sense because, you wouldn't have a job if that were the case. People
Right.
would just go out and,
Right. Just take their thing.
they'll just
Right.
Google, which,
Which
I'm
side
going to be
effects they
doing
take. Right. Yes.
video on, the
Yes.
information, too much information gathering and contradicting information that they're getting on the internet. So, but talking to their doctor if they have any major medical conditions that they can talk to their doctor about what vitamins can work for them. But
Mhm.
aside from that, like your everyday person who doesn't have any like severe medical conditions, they could go in and they could get vitamin D3 typically.
Yes.
Yes.
Yes. They're
Okay.
easy to get, very inexpensive, and people feel better very quickly.
Better than D, regular D or D2.
It's D2 or D3 is
Oh,
typically what you get. The bottle
who knew?
itself may say vitamin D, but when you flip it around to look at the ingredients, it will say D3 or D2, but it's
Okay.
the common one is D3.
And when somebody, takes I know a lot of people who take vitamin D.
Mhm.
And a lot of times people just don't know like how much do I take? Do I do the serving like on the back it says 2 gummies
USDA,
for
right,
this.
recommendation,
Yeah.
right. And again, it depends on how low your levels are. But you could get, if your levels were really low, sometimes, and I'll sometimes prescribe a dose of 50,000 units a week. So it's a one-time dose. And lots of medical doctors will prescribe that, if your levels were really low. So it's nice to check. So really, I would recommend for you guys to ask for it to be checked if it hasn't been checked to date. If your levels are pretty good, like, 30, 40, 50, you might do okay with 2,000 units a day. If you haven't taken it, here we are in starting February now, we're in 2025. And you haven't been on D for a while, I would say, if it's February and you're just watching this video and you're like, oh gosh, I haven't been on it, you could start with 5,000 units a day pretty easily and tolerate it fine. But again, have the conversation with your doctor. And in the functional medicine world, the numbers are different than the ones you're going to see on your lab values. And so they're recommending that you try to shoot for a level of 80 in your blood of vitamin D. So we really push it up high because it's so protective.
I would
Auto,
definitely ask the doctor about that because I would not trust my judgment to be able to look at all the it seems like when we go and we get things done and we look at it, it's like, what does this mean?
right.
And
But
we're
you're
counting on the doctor to explain all
right.
that.
But I'm saying that to you guys because
Yep.
you can push back and you can ask and you can do your own research, because some medical doctors, you might be a level of 30, which is technically, according to whichever lab you went to, it might be considered within normal limits. But in the functional medicine world, we're saying that's not enough to keep you healthy. So sometimes there is a discrepancy, and vitamin D happens to be one of those. And so you can
Yeah.
do your own research and you can, find out your information. And your doctor may be progressive and may know that it's okay to be higher than 30.
Okay.
So just
Okay.
for you guys to know, like 30
So
is
talk to your
really low.
doctor. I just want to touch on one quick thing from perspective of being a therapist and seeing clients. And, when the client comes in, I'm always asking about medications. When was the last time you saw your doctor? What's your relationship with your doctor like? Are
Mhm.
you comfortable asking questions of your doctor?
Right. Good.
So, but quickly on the seasonal affect, I mean, we've always called it seasonal affect disorders. You feeling more depressed when in the wintertime with the less sunlight. And I have had 2 clients most recently whose doctors prescribed them an antidepressant only during
The
the
winter.
few months of the winter. And I just find that to be, from my perspective, it's like, what? Wasn't there a better way to come at this? And then when I ask more questions, they're not taking vitamin D. They're the doctor's saying, here's an antidepressant, and here you take this during that time. And for years, year after year, I had one gentleman, 3 years he had been taking them, and no therapy, no vitamin D, no vitamin assessments at all. So it's no surprise that he's getting depressed,
Mhm.
even outside of the seasonal affect, because as it turns out, he might have more depression than just seasonal affect.
Well, low vitamin D is gonna cause you to feel depressed year round.
Yes. Mm. Right. So
It's not, yes.
So when we're
Is
talking
it
about adding
depression or?
vitamin D, we're not talking about, hey guys, go to the store, stock up on your vitamin D3, and then stop taking it once the sun comes out in the spring.
No,
No, we're
it's a
talking about
year-round
this is a
situation.
year round.
Yes.
So that depression, that vitamin D helps elevate that depressive feeling.
Mhm.
And so when we talk about depression, so I'm going to speak to a little bit about the symptoms of depression. And what we see is, again, your eating patterns change, your sense of appetite, low energy, lack of focus. You'll see people who just can't focus at all, lack of energy,
Mm.
and they that brain fog sometimes people get, where they just feel like they're just not as quick. So the vitamin D can help a lot with that. You mentioned B as well. What was, so you had D as, and was it B?
What I had mentioned earlier was the doctors will most likely do a lab test for vitamin D and for B12.
B12.
That's
I've
one.
taken B12, works very well, increases my
Yes.
energy.
Yes. Yes.
Mhm.
So, yeah, did you want me to dive into some other causes for depression that might be helpful?
Yes, that I would love to transition us a little bit away from the supplements and more into the food part, because
Yeah,
I
because that's what
people
I
are
was
really
actually
interested in
that's what I
that.
was actually just
That
thinking
would be
about.
great.
So when you were mentioning like you know, the symptoms of depression, it reminded me of just in general eating and how people eat. So I have, like, in my caseload, I have a lot of people that have even just PTSD and ADHD and depression and all kinds of other conditions. And what I've noticed is, I'm going to just start off with one of the number one things you can do is pay attention to your protein intake. So a
Okay.
lot of people, when you talked about, folks that are feeling depressed that might have a loss of appetite, or people that are over consuming foods, or even people that are finding themselves snacking a lot, have low brain fog, sort of low energy, kind of just muscle weakness, and just don't feel great, like the poopy syndrome. Like, I just feel poopy, you see
Okay.
those commercials.
I've
And
never seen
one
those
one of my one of my favorite
Poopy. Let's look that one up, folks. Okay.
so when I start asking people what they're eating, what's your typical breakfast? And they'll tell me, what's your typical lunch and things. And people aren't really aware of our protein requirements, which is really imperative just for simple energy. And, with protein, which is often associated with meat, there are so many essential amino acids that we need that really impact so many functions in the body. So I like to teach people first and foremost, what do you mean? How much protein are we talking? Because people are like,
What
I've,
is protein?
I've literally had people be like, I eat nuts. Like, I'm eating protein, but I want people to understand how much protein is required and how to get there. And so
Okay.
protein is a source. We call it a macro. We have proteins and carbs and fats, and it's like what makes up our food. And most foods have a little bit of protein. Like there's a little bit of protein in broccoli, but we don't usually associate vegetables as a high protein food.
Okay.
So, but it's helpful to have an understanding of where you can get the best bang for your buck for protein.
Okay.
So, a serving size of meat, we're usually looking at around 30 grams of protein.
What kind of meat? Like, is that just red
Chicken,
meat? The chicken too?
pork,
Okay.
beef, all of it, right? So meat in general is a great protein source. If you're a vegetarian, we're talking more like tofu is kind of one of their primary sources of protein, but I don't necessarily recommend vegetarianism for kiddos because they're missing a lot of those amino acids that we get in meat, but that's another topic for another day.
Yeah.
I don't want to go too much off the side. Right. So the protein, so if people can really just start with what's your first time you eat? And I'm not asking anybody to change their whole life. I'm saying, when do you normally eat and what do you normally eat? And so if you can start with your first meal of the day when you break your fast. So at night, we stop eating while we're sleeping. Hopefully you're not eating throughout the night. But when we break our fast in the daytime, if you can focus on a high protein meal at that time, or make sure that you have adequate protein. So this is the formula. Let's say an average size adult, we'll say I don't know maybe 180, 160, 180, somewhere in there, maybe average weight for a full size adult. So we'll go with a 180. Half of your body weight would be 90, right? So if you're 180 pounds, half of your body weight is 90. So you require at minimum 90 grams of protein throughout the day. So for 3 meals a day, you would have a minimum of 30 grams of protein. What that does is it stabilizes your blood sugar. And that's where a lot of our moods and our dopamine and epinephrine and norepinephrine, a lot of that stuff is contingent on a stable blood sugar. Your cortisol release, your response to stress. You're in a state of fight or flight. You're constantly up here like, oh my God, oh my God, oh my God. That's kind of what I call my people in constant fight or flight. And they recognize it and don't want to feel that way. But having a stable blood sugar is imperative to really getting your mental health, help you respond better to the therapy, help you respond better to the medications by stabilizing that. So if you have a kiddo kiddo with ADHD, you're an adult with ADHD, doesn't matter. You start your morning off with a higher protein meal, you're setting yourself up for the day. So when back in the day we were taught breakfast is the most important meal.
I was just gonna say that.
And it makes me roll my eyes because we all heard it. We were like, it was like ground into us, And so, but it's not about eating breakfast, it's about eating the right thing. And the old, what do you call it? The table with the food chart, and you have grains at the bottom. That should be completely wiped out. Forget all that. Really should be protein, should be the base. And you don't need traditional breakfast foods to get your protein. And so it's hard. Like a lot of
So
people
I
have
can
like,
have a steak for breakfast?
have a steak for breakfast, have your
Steak and
chicken.
eggs?
I've have a lot of families and they're like, yeah, we make, our own homemade chicken nuggets and put them in the air fryer. And we make up a big batch ahead of time. You throw some chicken nuggets in the air fryer for breakfast and kids got protein for the day,
So you could, so what you're saying, what I'm hearing you say is that, um, what, that it's not about like getting that first eating rate within 20 minutes of waking up, you're going to eat. Okay. So for you, if you're saying is that the protein, you could actually get your daily limit of protein, the bulk of it in the morning, depending on what you're eating. Correct. And
You
that should be a goal.
It could be,
Could be.
yes.
Okay.
Ideally,
Write that one down.
ideally the body does better if you break it up a little bit.
Okay.
And some people have a harder time digesting too much protein all at once. So that's why we tend to recommend breaking it down. But yes, you could go heavier in the morning. But remember, if you're eating protein only once a day, you may be destabilizing over the course of the day if you're just eating just simple carbs, because you're gonna end up still having a little bit of fluctuation in your blood sugar. So the goal is to really try to keep it as stable as possible.
Okay. But but what you're saying too, though, is hey, be really aware of the protein in the morning. Get that protein level up.
Yes.
Not only because you can get your protein in, but will that energize us throughout the day?
Yes.
Is that what
You're
the
gonna
goal is
focus
too?
better. You're gonna
Okay.
sit in your chair better. You're gonna feel your brain. You're not gonna.
Sitting in
It
my
takes
chair.
care of that poopy feeling that I just don't feel good, kind of. But you just can't quite put your finger on it.
Yeah. Okay.
It's
So
like, yeah,
that's great. I
yes,
really like that. And so when we talk about children in particular is teenagers, actually, let's talk teenagers, because that's my thing. Teenagers, they're so hard to get out of bed in the morning, and they're like dragging, they're going into school and it's taking them so long, whereas some kids like my daughter, she's like up 5 o'clock in the morning, she's getting ready, she's energized in the morning, she's hungry right away, she's eating. Apparently she is probably doing pretty good with the protein, because she is more, and she, the moment she gets moving, she's to go. But parents who have teenagers and they're like, oh my gosh, they're hard to get up and hard to get them fed, like having more protein in the morning can help them not feel so sluggish throughout the day.
right.
Any suggestions of what some of your clients who have teenagers have done for morning, and or for, eating that, getting them to eat protein, because they're snackers.
Yeah. So I always just really get more information about what the kid does. What, does he eat, does he eat school lunch? Does he bring home lunch? Family this week, mom is like, yeah, he sometimes comes home and he hasn't eaten all day and his blood sugar is out and he's not doing great in school. And if a kid's not doing great in school, starting with what they're eating can really make a big difference in school performance. So what do families do specifically? I love having people get meat sticks, throw meat sticks in the backpack so that they have, because they'll hold well. Meat sticks and high protein bars that are, self-contained. And so just to be clear, when you're looking at protein bars, if it says protein bars on there, that's not enough information.
Oh,
You have to read how many grams of protein we're looking at. So if you look at your 30 grams of protein per day, or per meal rather, at minimum for most people.
that's 3 meals a day. That's the 90 gram.
Right.
So,
Yes.
okay, so when we were talking about like the person who weighs 180 pounds and we put
Sure.
half of that. So if I weigh,
But that's a
not
minimum.
me, but if I weighed 140, half of that would be
70. And I rounded up to 75.
Why?
Just because we need more, it's more than that usually.
Okay.
So 25 grams of protein, because it would be an
So
uneven
that's
number.
a day.
70 a day.
Yes,
Yeah,
and then you break it up. If you break
to
it up
3.
into meals.
Yes.
Okay, okay.
But that's,
You're
and
on.
that's a minimum.
Okay.
That's minimum.
So the protein bars that you're talking
Right.
about.
So I would go for at least at like a 10 or 15 grams. So at least they get a little bit of protein in there, so, but a lot of protein bars, you'll read the label and it's like 3 grams of protein, and that's
So
almost,
that's not good?
it's not enough.
Not enough.
No.
And so are there protein bars that have more?
Yes, yes.
So if there's 3 grams of protein, what's in the rest of it? What's in
That's
it?
bingo. There you
Some
go.
sugar
Those are
where
the
you
kinds.
go up and then you go down really quick,
Yes, that's
right?
right. That's
That's
causing
another
problems.
discussion
Right.
for another
So you're
day.
looking to enhance school performance. So really getting your kiddo on board and teaching them. So I remember, I had these girls years ago and they didn't have great appetite. So this is a little key for families that were like, what do we feed our kids? They didn't have great appetites. And so what mom did is she would, and the girls bought into this. They would start with their protein on their plate and they would consume the protein first, and pretty much whatever else they could eat after that they wanted, they would eat it. So but they would put their energy into eating the protein, and those kids did so much better mood wise, behavior wise, school performance wise.
Wow. So as
Everything
long as
was
they had
better.
protein, it didn't matter what they had after, as long as they got that protein, those are those baby steps. Those are
That's right.
those small shifts.
Yes.
And I want to add to that because you're going to hear me talk a lot about that as you watch more of my videos, is small ordinary changes produce extraordinary results.
Right.
Okay.
Yeah.
So you don't have to kind of like jump in and be like, I've got to do everything
No.
now. I have to do
No.
all this protein.
Yeah.
And then I've got to cut the sugar. Then I got to do the dairy. Then I got to go buy the vitamins. No. And that's why I wanted this video today, because I really wanted people to understand, the concept of functional psychiatry, functional medicine, and but I wanted people to have some things that they could take away, that you could do in small, just today,
Yes.
sitting down at the table and saying, okay, right? Or when you're cooking the dinner, look at the dinner and say, tonight, you probably already have your meals planned. So go in the grocery store and rebuying everything is not a recommended thing at the moment. So we go in, we look at this and we say, okay, where's my protein?
And if you start with things you already like, again, when you talk about small shifts, start with what you're already eating. If you're like, oh, I'm already eating eggs in the morning, great. Eggs is a good source of protein, and eggs are about 6 or 7 grams per egg. And so if you had 2 eggs, you're at 15 grams of protein.
Okay.
Okay. Or 14, 12 to 14. Actually, it's not quite 15. So, and so you're like, okay, that's 2 eggs, but I need 30. So what else can I do? And so you look at the ingredients of the food if you're putting them on an English muffin, how many grams of protein are in an English muffin? And so, okay, I need more. So when we add some meat and you're like, okay, I'm doing bacon or I'm doing sausage, how many grams of protein? So do the math. Do food math and find out. And you can do what I tell people is, if you really don't know where to start, go on the interweb and do a little search for high protein foods.
Every time I hear that, I cringe.
I know I say it because it's so funny. I know.
Can I add something about that?
But wait,
Okay,
just
you
let
go
me
ahead.
finish my thought. So go and find a sheet that you can print off that's high protein foods, and you can throw that on your fridge. And or the things that you're always doing, you could even go on your jar of peanut butter and write, 1 tablespoon equals so many grams of protein. That's another good one to add for your day, some peanut butter. And so make it easy for yourself and have a cheat sheet for yourself and do the math.
Idea.
Don't just assume because I'm eating eggs, I'm eating enough protein. Yes, it's a protein source, but it's not enough.
Okay. That's a great start. It's a great start for people. Yeah. So just to kind of recap a little bit, we could do this for hours, and I could take this in lots of different directions. I have you prompted some really I have so many more questions, and I have
Cool.
no doubt that my audience will also have lots of questions to
Yes.
follow. So what we're gonna do is I'm gonna follow up with a couple of things, and then we're gonna do some additional videos. So if you have any questions about any of this that you have learned, shoot me a message, shoot an email, and I will keep track of those. And then we'll have Peggy come back and we will do a question and answer session so that we can kind of, clarify some things, because I don't know about you. I mean, I understood a lot of what Peggy was saying, but what the heck is amino acids? I mean, like, I'm some of that stuff I don't really know, but I'm so happy that she knows it and then other people know it as well.
Right.
And what I'm noticing is more and more people out there are starting to be more diligent in reading the ingredients
Yes.
on the boxes of what you're buying. So my brother, who is 40 something, and he was telling me the other day that he goes into the grocery store now, and he it's taking him so much longer because
Yes.
he's now caring about what he's putting into his body. And he said, "Hey, miss, it just takes, to sit back and know what to look for." But he has to, like, really try to understand what the heck are all these things. So, you know, and it gets so overwhelming, it doesn't feel worth it. And then the price can get so high. So I do think this warrants a really great, doing a video with maybe some hands-on things. Maybe we can bring in some protein items, some protein bars, and we can kind of look at the ingredients and talk about, what are some of these major things. But as for today, protein, protein. That's one piece today. And so we D3, talk to your doctor if you have any medical conditions, increase in that vitamin D3, and not just during the winter time. Even if you are an extreme sunbather, okay, you still
Get your
need
levels
vitamin
checked.
D.
Get your levels
Get
checked.
your levels checked.
Mhm.
So, okay.
Yes.
And just because you feel depressed in the wintertime doesn't mean that it's just seasonal depression. Talk to your doctor about the depression. Go to a therapist, okay? So when we were talking about before about depression and the symptoms, we talked about vitamin D3 being helpful, and we also talked about introducing vitamin B12,
Mhm.
which you can get, at the grocery stores. I take B12. It helps a lot with my ADHD, and it gives me a little bit more energy. So I think that those things are really great. So we get the protein, adding the protein, and we've got the vitamins,
Mhm.
and those can help with your moods and increasing your oh, what's the word I'm looking for? It's failed me.
Your energy,
Menopause.
your energy.
Is my energy low? Do you think that's why I sometimes that
No, I
happens to
wasn't
me?
talking about you. I was finishing your sentence.
I'm kind of menopausal. So like sometimes I get a little forgetful, and Peggy and I have talked about that, and maybe we'll do a thing, a video
Yeah,
on menopause, because
I just did a video.
you
I
have
have a series on YouTube, and it's called Questions for Peggy. And I just looked it up before we met. It was episode number 66. And I really do a deep dive into memory and cognition and some supplements. And the question that the client had asked was, she had a mom with dementia, and she was asking questions about that. And she was like, what can I do to help my mom? And so I did a really good deep dive there. If you want to check that up, we could potentially link that to this video
yeah,
too.
we'll
Yeah,
link that.
yeah,
Peggy
because it
has
was really,
series of videos.
really informative, and really went more into the vitamins and stuff that you should be taking every day. So,
Okay. I want to end with something that is at the time when we talked about this ahead of time. I think it was when we had dinner together last night.
mhm,
And she cooked for me and showed me how to kind of look at, how, okay, so we've got some vegetables here, and I've got the protein here, and so it was really great. But when she told me to put down my fork, I was like, excuse me, this is good. I'm eating. And she's like, eating, you were saying how after each bite of putting your fork down and just really chewing up your food good and before swallowing it. Could you just tell the audience why that's important? What happens? You were mentioning enzymes and
Yeah, so
slowing
thank
things
you.
down.
Yeah, so as I've met with lots of people, when people come to see me for treatment, I do something called a root cause assessment. That's the like one of the first things I do to get a really good sense of what's going on inside the body. And literally every single person that I have worked with in my private practice have a deficiency in digestive enzymes. So our body produces enzymes that break the food down. And that we start producing our enzymes when we're cooking, when we're smelling the food, we're preparing the food. So you walk into a home and you're like, oh my gosh, it smells so good in here. Your body is producing those enzymes. And so it's one of the big causes for why we're not breaking down food, and we end up oftentimes with gut issues and bloating and all kinds of different conditions because we're just like mindlessly eating. And we're like, oh, I'm going to eat on the run. I'm going to go through the drive through, eat in my car, quick, quick, quick. I've got 15 minutes and I'm going to want to do all these things and I'm just going to shove food in my face. And that is literally creating a lot of havoc. And it comes back to, nutrient absorption. And so we're supposed to be fueling ourselves with these delightful nutrients in our body, but when we're not creating the enzymes that in the bile release, where that's where like a lot of the stuff is broken down. So one of the tips is before you eat, and so first of all, prepare your food with love. It makes a difference.
Okay.
And
And
secondly, right? So you
okay.
serve
Yeah.
your food, you put it on the plate, and really there are lots of cultures and traditions where people like show gratitude for their food. They might pray, they might have just a moment of silence and thank you for the food and the farmer that farmed it, la, la, la. And so, and then you start eating, you take a bite and you chew it and you enjoy it and you notice the flavors in your mouth. And it's really called mindfulness,
Which
which is
we
something you
I
teach
teach.
in your practice.
Yeah.
But it's about mindfulness, but you're allowing your body to actually, you're chewing it and it helps to break it down. And so I heard this saying a long time
Amazing to me.
ago, your stomach doesn't have teeth, meaning you just don't shove the food in and just and you to expect your food to digest well. Your stomach's not going to break it down. And if you don't have enough stomach acid, people think of stomach acid as a bad thing, but we produce the correct stomach acid to break the food down, and it prevents indigestion and all those problems that people are having. So chewing your food, put your fork down, smell it, taste it, chew, chew, chew. It should be, the size of like baby food, like the babies could eat it before you swallow it. So the more you chew it, the easier it will be for your body to digest it, and you'll be able to assimilate more of your vitamins and minerals out of your food.
Well, thank you for that.
Yes.
Such a great description. And last night when she was telling me that, I was taken aback. Like, isn't it a compliment that I'm like loving on your food? And so, but what it reminded me of is with my clients, I teach mindfulness and teaching them how to learn how to quiet the mind and relax the body, learning how to stay in the moment. And dinner and meals is where I start with my clients. I'll say, okay, so, what are you serving tonight for dinner? And they'll walk me through it. I'm like, okay, so when the plate comes on the table, whether it's a little kid, I've had 6-year-olds doing this, by the way, and they sit at, and I have them go through their 5 senses and just look at it. Just don't judge it, don't interpret, just look at it, smell it. And that tasting piece, now what we're learning now is that the tasting piece, if you chew it and let it stay in the moment, what I noticed last night was the flavor was better because it was like it was sitting on my taste buds and I was just like,
You're hitting the
"Mm,
different areas of your taste buds that all have different functions,
yeah,
and they pick up different. So if you're just shoving the food down, you don't even have a chance to enjoy the
yeah,
flavors.
yeah."
It's amazing.
So
Yes.
just some of these little changes They don't have to be painful,
Right.
which was good news for me because the thought of having to give up all of these things, just to live healthier and feel emotionally better can be, it was overwhelming to me when I'm thinking, these days, like, okay, I got to give up sugar, I got to give up dairy. This isn't good for you. That every time I feel like every time I'm grabbing something, somebody's saying, that's not good for you. That's going to make you feel like this. And it's like, I don't even want to eat anymore with that. But that's I really wanted everybody to hear that it doesn't have to be this love bombing of change,
Right.
right?
Yes. Yes.
So,
Small changes,
small changes
sustainable. That's really where I come
from
from.
yours, yeah.
Simple, sustainable changes that stick.
Mhm.
And so we want you to have some lifetime habits that make, if you just know I got to have protein and you start with that every meal, it's like it simplifies your life, and it doesn't have to be complex.
Great steps.
Yeah.
Great
Yes.
advice, Peggy. Thank you
Yes.
so much for joining us.
You're welcome.
And if how could my viewers reach you if they want to learn more about or they want to watch that video we were talking
Sure.
about
Sure. My,
cognition?
my channel is called Questions for Peggy
Okay.
on YouTube.
On
You can
YouTube.
look that up. And my website is www.functionalfamilypsychiatry.com. And we'll put that stuff on the end of the video under the description
Mhm.
so they can find out more. So great.
Well, thank you very much. Don't shut it.
No,
I wanted to add this is my first video of piloting my new program. I hope this was helpful for everybody. I would love to hear in the comments anything else that you are interested in understanding about mental health, addiction, emotional well-being. That would help me a lot as I'm forming new videos and interviewing additional experts. And I'll also be talking a lot about my experience and the things that I've learned that I want to pass on to all of you to help you be able to manage your emotions and your emotional well-being on your own. Thank you. And till next time. See you
bye.
later.
Thank you.
Bye.